Since time immemorial, Uttaranchal has been the symbol of faith for the entire country. Its spiritual magnetism, deep-rooted culture and simple people has attracted many saintly souls. Uttaranchal has been gifted with beautiful towns, temples, developed tourist places and educational institutes.
But then, the region is also the most neglected insofar as medical facilities for rural areas are concerned. To bridge this clear gap, somebody is reaching out, touching all bends of these serpentine hilly roads. It is the Uttaranchal Mobile Hospital and Research Centre, a clinic on wheels, a complete diagnostic and treatment centre that reaches out to the vast, far-flung remote areas of the hill state of Uttaranchal. Inspired by Dr. Colonel C.S. Pant, VSM, a well-known radiologist and ex-president of Indian Radiology and Imaging Association. The Uttaranchal Mobile Hospital and Research Centre is a joint effort of TIFAC, Department of Science and Technology, Government of India, and Government of Uttaranchal, and is being implemented by Birla Institute of Scientific Research, Bhimtal. This gift is making its value felt not only in Uttaranchal but all over the world.
The aim is simple: to bring advancements in modern medical sciences at the doorstep of common man, who otherwise would have been deprived of its benefits. Initiated in October 2002, Uttaranchal Mobile Hospital and Research Centre is today an extremely popular and a practical healthcare model. It has been conceived keeping in mind the specific needs of the remote hilly terrain of Uttaranchal, where modern healthcare cannot reach the needy and poor people.
After reaching out and serving the needy for over 3 years, the project has become a role model for its well-utilized money and provision of advanced diagnostic care.
This is Dehradun, situated at 2,500 meters above sea level, is known for its scenic beauty and temple of Devi, a site of a popular fair. The famous hunter Jim Corbett's tale, Temple Tiger, is also associated with these temples. Today people are waiting here for this mobile clinic to arrive at the Devi temple. This shows the enormous faith people have in this system. Out of the numerous stops in the region, Dehradun has been witness to regular medical camps, where qualified doctors and diagnostic facilities have successfully delivered medical care at the doorstep of the Devi temple. The staff of mobile clinic starts setting up the camp. A pharmacist sets up his table, a tent is set up for a lady doctor, and another team of doctors along with other staff are all set to hold a camp for the day. The registration counter is open. Patients are registered by paying a nominal fee of ₹10 for 2 visits. Those who have been issued below poverty line ration cards by Government of Uttaranchal are offered investigating facilities like X-ray, ultrasound, ECG, lab tests and medicines free of cost.
Uttaranchal Mobile Hospital and Research Centre was launched on October 19, 2002 by His Excellency Dr. APJ Abdul Kalam, President of India. Since then, every month 15 camps are held on predetermined dates and the same place is visited once a month on the same date, irrespective of a holiday or Sunday. Demand for this service has grown and people queue up to get treatment from this clinic even though it comes once in a month to their doorstep. There have been clinics on the wheels all over the world. But what makes this mobile clinic unique? Now running into the 4th year of operations? The very idea to have one and the development of its working model germinated from the vision of Colonel C.S. Pant.
People have been asking me, what prompted you to go for such a thing, and I think one of the journalists he said certainly that I want to provoke you. Why you are getting such an expensive van which is being done? I thought it is not at all expensive, it is the need of the day. And I was saying even in present today in Almora, Almora and Pithoragarh area, though they have an X-ray and ultrasound available, but most of the time either there are no films or there are films, is out of order.
A mother rushes in with her son. Hemant has had a fracture which has been fixed by the local government hospital. His mother is a lady with little knowledge, but knows that she can get clear X-rays from the latest state-of-the-art X-ray machines in this mobile clinic. She wants a correct opinion from the doctors at this clinic as she dare not rely on the flimsy X-ray. Today, technology has truly arrived at the doorstep of rural population living in Uttaranchal.
In the Vision 2020 document, it was told that our public primary health center and others do not have good diagnostic facilities. If you don't have a good diagnostic facility, X-ray machine ठीक नहीं है, ये blood report का ये ठीक नहीं है, time लगेगा, कोई आते हैं आज काम नहीं करता है, कभी जगह में नहीं है. If this is there, then what can a doctor do? He cannot take that thing and diagnose the patient. So this, put them all together, move it. It is technologically possible because of miniaturization of today. 20 years before, one X-ray machine will be so big, it will be 3 times this area is required. Now we can put a very advanced technologies inside.
The X-ray equipment is capable of doing X-rays of almost all parts of the body, especially chest X-rays in diagnosing and monitoring cases of pulmonary tuberculosis rampant in Uttaranchal. The mobile medical team comprises of 1 lady medical officer, 1 physician and 1 radiologist. Besides, it has a full complement of over 11,000 ultrasounds, 6,000 X-rays, nearly 2,000 ECGs and 23,000 lab tests have also been conducted. It is interesting to note that below poverty line population comprises nearly 50% of the patients.
बिरला इंस्टीट्यूट ऑफ साइंटिफिक रिसर्च का एक उद्देश्य ये है कि जितने आंकड़े इकट्ठा हों उनसे कुछ वैज्ञानिक निष्कर्ष निकाले जा सकें और सारे रीजन में जहाँ जहाँ ये मोबाइल हॉस्पिटल चलेगा वहाँ पर किस तरह की बीमारी किस समय में होती है जिससे पहले से उपचार के साधन इकट्ठा किए जा सकें जिससे रोगियों को समय पर मिल सकें. बहुत बड़ा दायित्व भी है कि ये भारत सरकार की योजना सही रूप में सही तरह से सही लोगों के लिए काम में आ सके.
आज के युग में जिस तरह से उपकरण नए नए आ रहे हैं, चिकित्सा के लिए निश्चित रूप से गरीब व्यक्ति के लिए उस चिकित्सा को पाना कोई आसान बात नहीं. तो इसलिए इस टाइप की योजनाएं जो चल रही हैं और मैं विशेष रूप से आपका आभार प्रकट करता हूं और इसमें राज्य सरकार का भी सहयोग है. राज्य सरकार की इसमें भागीदारी है इस गाड़ी को चलाने में.
65-year-old Mr. Ambadat has walked 15 kilometers to reach the site of the camp. He, along with others, are waiting for the mobile clinic to turn up. Travelling on poorly maintained hill roads with heavy sensitive medical equipment is tough. Very soon, the mobile clinic has a hurdle to cross. But 4 years of daunting experience and coordination among the staff helps it to go ahead. The mobile clinic was specially developed by a leading automobile bodybuilding company in India on a chassis with air suspension to support the heavy equipment. Care has been taken that it has a span of 24 feet in length, which is maximum permissible in the hills. For 3 years, this mobile clinic is carrying on. However, the terrain and the continuous running is now taking its toll. Breakdown is also a regular challenge. In winters, the diesel fuel often freezes. Mr. Mohan Chandra, the ECG technician, with the additional charge as a registration officer, is a worried man. For him, it is important that the camp is held on time. With the project coming to its completion and the vehicle fast reaching its prime, it's time now to look for fresh funds to upkeep this vehicle and commission many more such mobile clinics, not only in Uttaranchal but other areas where the majority of the rural population is below the poverty line.
The consistency of this program is, you will see, the people are coming from every walk of life on fixed days. We have a fixed date and we have to reach on the fixed date, so people have trust on the mobile hospital.
The mobile clinic still manages to arrive on time. The government-run primary health center is the venue of the camp. One can clearly see the state of affairs at government-run healthcare centers. According to the National Commission on Population, most of the 257 primary health centers in Uttaranchal are dysfunctional for lack of doctors or equipment. This clinic is definitely filling the void. Ambadat moves to the registration desk along with others. With a qualified and experienced doctor at the camp, the question of why people are queuing at this mobile clinic despite an existing state-run primary health center is soon answered. Lakshmi Dutt Patni has been undergoing treatment at this clinic, and regular visits to the clinic have helped him overcome his illness. He is now perfectly fit. Ambadat has been suggested certain tests by the doctor. For him to get these tests done, he would have to travel for 6 to 8 hours to reach a diagnostic center.
On an average, we spend about 1,000 to 1,500 rupees, not on medical care. We do on medical care, but only on the transportation of our people from place A to place B to accompany the patient. You know, that kind of a situation is there where nothing is available. So, if two people have to go with them, they have to stay, they have to, so travelling time, man-hour loss and all that.
Ambadat, as advised, undergoes all tests recommended at the computerized pathology lab. The laboratory, besides doing blood and urine tests, is capable of doing almost all the blood biochemistry tests like sugar, cholesterol, urea, lipid profile, etc. Availability of ECG machine is handy to evaluate patients suffering from various heart ailments. Take the Someshwar Primary Health Center. It has no lady doctor and is not equipped to offer antenatal care to expectant mothers. But the arrival of the mobile clinic with a lady doctor sees a large turnout of women patients. Today, the ultrasound at the mobile clinic is proving to be a boon for female population by helping the lady gynecologist diagnose and provide curative health care on spot.
Females in this area are the most downtrodden and uncared for lot. They are the worst sufferers also, and they are the most hardworking of the lot also. And there are so many problems related to females. When I come here, every month I am seeing antenatal cases, and I am seeing other problems related to females which only a female can understand. And apart from health problems, there is malnutrition, anemia which goes undetected. And there are several other problems which have to be looked into. And another thing is that there are very few LMOs, lady medical officers, in the region as part of the government machinery also.
By the afternoon, investigating reports are distributed. With a recent test report in hand, Ambadat waits patiently for his turn for consultation. He has been prescribed expensive medicine, which is issued without hassle. Hemant's reports are out. The smile on his face says it all. As the camp winds up, the team sits down to discuss the day. Then the team travels to their hotel for a night halt. It's a routine to be followed for the next 15 days. In a relaxed atmosphere, Mohan and PC Pandey compile the day's data. Medicine stock and further requirements are noted. Planning for the next day is also finalized. Mr. G.D. Palaria, the administrative officer, checks out the route map. Richa Khanpal is missing her 1-year-old daughter and soon gets engrossed with furthering her knowledge.
Non-availability of quality schooling facilities for children and other basic facilities to doctors have been a major reason for their reluctance to serve the rural areas. The health planners of today in India are taking a cue from this project, as this module serves the dual purpose of both patient care and personnel need. Here, the medical team is stationed in the district headquarters, and after completion of each route, they are given a break to cater to the needs of their family, especially the education of their children. The cost of the mobile van is wholly sponsored by TIFAC, Technology Information Forecasting Assessment Council. The salary of staff, expenditure on medicines, X-rays, lab reagents, vehicle maintenance, insurance, etc. is being shared between TIFAC and Government of Uttaranchal.
Apart from healthcare, the UMHRC is also compiling a demographic profile of diseases prevalent in the area at Birla Institute of Scientific Research, Bhimtal. The medical data, including the patient's registration, is being fully computerized so as to generate medical profile of hitherto inaccessible terrain. This will go a long way in providing input to the planners for future projects.
There are still places in Uttaranchal where people await such a service with increased frequency. The pace has been set for bringing modern healthcare services in rural areas. The need of the hour today is to bring in more funds to keep this vehicle running proficiently and its adoption on wider scale throughout the country, which will immensely benefit the rural population, leading to their overall development.
Our job is think, create the knowledge through the network, do action, keep some demonstration, keep it going, then you recede, so that it can multiply. Otherwise, हम जितना तक कर सकते हैं उतना ही, पैसा नहीं है कि आगे बढ़ना है, सबसे दूसरे के साथ करना है.
It's the will of the people to take this mission forward and accomplish a pioneering journey for betterment of mankind.